Hi, this video is the hair transplant restoration surgery on a black woman who happened to flew in from London for me to do the surgery. But you know, I have clients not just from London, but from Australia, from Europe, throughout Europe and Africa, Nigeria, Somalia, Ethiopia. But the most important thing is most of the hair loss, specifically for black women, this type of hair loss is a genetic. You have to have a genetic gene. Without braiding, you'll be thinning this part. Now, when you braid the hair, it will thin even faster, and those some people call it traction alopecia. But you notice that not every black woman who braid their hair lose their hair. So only those with the genetic factors for hair loss, the braiding will accelerate it. Again, genetic factor is the determining factor. But you know, medication can help reduce the hair loss rate. However, medication you have to take for the rest of their life, and sometimes it does have side effects. Really, the best treatment is hair transplant. Taking hair from the back and transplanting to the frontal area. But you got to find someone who specializes in the art of restoring black hairline, because it is an art form. It's not just taking the back and slapping the front and pray that will grow. Hair transplant is not a perfect science. Sometimes you're going to need more than one surgery to have perfect density. Or as you lose more hair, then you're going to need to do another surgery. Because I cannot do anything about the existing transplanted hair. But the transplant hair should be growing. And again, sometimes you just might need more than one. Sometimes you get away with one. The more you put in, the less you have to come back. But hair transplant tends to produce the best result. So for the woman, the temple hair, the temple begin right where the eyebrows begin. So where the eyebrows end, that's where the temple should. For men, where the eyebrows end, you can put a finger breadth, that's where the temple should begin. The angle for Caucasian men pointed most acute backward, Asian men less, black men perpendicular. But for women, it's not only closer to the eyebrows, but it's actually pointed toward the middle. The zigzag is wider in amount and higher in amplitude. Then, once we get the shape down, we will transplant at a very precise angle, and we follow the natural contour of the hair, the angle. And then not only the precise angle is important, but the selection of the hair graft is important. We transplant rows and rows of single hair graft in the front, followed by rows of 2 hair, 3 hair, 4 hair in the back of both the moya. There are a couple of side effects of hair transplant, and which we can go further. Some of them you have a chance of infection, pretty rare. There's a scarring involved. Some people have what they call at the base of the hair follicle, have little lumps. And that one, a lot of time is due to a genetic factor where the patient produce scarring. But not every woman has that experience. But it's quite unique among black women, but it's pretty rare. But majority of the time, we will try our best to minimize it. Again, sometimes genetic is the playing factor. So this is the art of hair transplant on a black woman, and we will attempt to do at least 3,000 grafts. Thank you.